Many patients come, sir, मैंने तो कभी अल्कोहल पिया ही नहीं, मैं तो कहते हो मौत खाना है, मुझे लिवर क्यों नष्ट हल? Why am I having liver disease? There are many causes of liver disease other than alcohol. Today, on the auspicious occasion of World Liver Day, let us bust few myths regarding liver disease. I am not having any symptoms, so I can't have liver disease. This is a myth because even liver disease can be present even in patients who are asymptomatic. The manifestations of liver disease like jaundice or swelling of the legs or abdominal distension or blood vomiting, all these occurs only in case of advanced stage of liver cirrhosis. In the early stage, the liver disease is asymptomatic. People with fatty liver usually do not have any symptoms. This is only detected on an ultrasound, and on an asymptomatic patients may have a abnormal liver function test on when they do their blood test. Fatty liver is harmless. Yes, fatty liver can be harmless in many occasions, but a fraction of patients with fatty liver, the disease progresses. They developed an entity which is called hepatitis or steatohepatitis, means there is an inflammation in the fat of the liver, and in the long run they can develop fibrosis, that is shrinkage of the liver, and ultimately cirrhosis of liver. I am drinking alcohol, but I am regularly taking some liver supplements, so my liver is safe. No supplement can prevent liver injury by alcohol. So if you are taking alcohol, your liver is going to be affected irrespective of any supplements you take. Beer is a light drink. That is a completely myth. It depends on the amount of alcohol you take. Beer contains 8% alcohol. So an average can of beer contains around 700 ml of beer. So if you are drinking 1 can of beer, then you are getting 56 gram of alcohol. 30 ml of whiskey will roughly contain 9 gram of alcohol. So 30 ml of whiskey is 9 gram of alcohol, and 1 can of beer is 56 gram of alcohol. As I know from my patients, most of the patient drinks 2 to 3 cans of beer. So the amount of alcohol is even, I would say, much more when you drink beer than you drink any other strong alcohol. Another myth is that many patients come, sir, मैंने तो कभी अल्कोहल पिया ही नहीं, मैं तो कहते हो मौत खाना है, मुझे लिवर क्यों नष्ट हल? There are many causes of liver disease other than alcohol. Liver can be affected as a part of metabolic syndrome. So the persons who have diabetes, who have metabolic diseases, who are obese, who have cholesterol, they have tend to have a fatty liver even if they do not drink alcohol. Patients with hepatitis B, hepatitis C can have liver disease and they can progress to cirrhosis. Other conditions like even autoimmune liver disease or Wilson's disease can have liver cirrhosis. Another one myth commonly patient comes to us is that they are having jaundice. So jaundice, and they think that they take some herbal medicines and their jaundice will be cured. So you need to understand what are the different types of jaundice. The common jaundice which we find is because of viral hepatitis A or E. So this jaundice is self-limiting jaundice. A jaundice to নিজে নিজে ঠিক হয়, আপনি যদি একটু দরব নলয় তথাপিও jaundice to ঠিক হয়ে যাব. So in this type of jaundice, everything will act. যে আপনি জি লয় নলয় বেমাৰটো ভাল হ'ব 99% patients. Only 1% patients will develop liver failure in hepatitis A or E. So, but on the contrary, many herbs are hepatotoxic, means they are dangerous to the liver. The viral hepatitis improves, but the patient develop a liver injury because of the herbs they take. So if you are having jaundice, do consult a doctor. Don't self-treat yourself. So I would conclude this session with the theme of this year's World Liver Day: solid habit, strong liver. So let's develop solid habits, avoid hepatotoxin, enjoy a good and healthy diet and lifestyle, and keep our liver healthy. Thank you.